Oh, thank you. I had never had white teeth, and I wanted some white teeth in my mouth. But the dentist wouldn't pull them all because he was insisting that I do a partial, because I didn't start off here. I started off at another dental place. And he started getting kind of smart with me, and it pissed me off. So I say, okay, I'm just gonna find me another dentist. I'm not gonna work with him. And I saw Living Local in Fort Wayne, and Jessica was interviewing and doing a segment about Simba Dental. And I said, I'm gonna try them. And I called, I got their address, and I told my auntie about it. And me and her come out here.
Yeah.
And I'm glad I did. Yeah.
They look beautiful.
Oh, man.
They make you feel like family. They do. I know that's the way I feel. I done sit up here and cried and squoze hands because it's been a long time coming, but it's worth every minute that I waited.
That's that big Kool-Aid smile on your face. I know you've been waiting on that for a long time.
Pam came in a few months ago, and her main concern was that she really just wanted some teeth. She came in and she asked for dentures. Now, typically, anytime I have patients that come in and ask for dentures, I'm always like, whoa, 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 let's take a step back. Why? And usually it's because patients have been in a lot of pain, spent a lot of time in the dental chair, and they just don't want to deal with it anymore. So at that point, I stopped and I said, all right, Pam, let's have an honest conversation about what you want from your teeth, right? And so there was a couple things she brought up. She wanted to be able to eat her steak, and she didn't want her dentures to pop out when she's hanging out with her friends. I can't remember the story exactly, but she had a friend whose denture popped out while they were all hanging out, and is basically the butt of the joke in their friend group. So yeah, we weren't gonna have that happening with Pam. Right from the jump, I knew I wanted to make sure that she looked good, but also she was able to eat the things she wanted. And with 2 conventional dentures, you know, eating super tough foods doesn't always work. So that's when we had some conversations about partials and things that have better retention, things that are gonna hold in better for her. She was a unique case because she has mandibular tori, also known as exostosis. In layman's terms, it's just some extra bone that she had on her bottom jaw. And that can be an issue on fit, so we did have to take a surgical approach to remove all of that and make sure everything was nice and smooth. I'm really grateful that Pam trusted us along that process and gave us the opportunity to do that for her. It took a few months, there was a lot of healing, but now we're able to give her something that she's really happy with. This delivery was pretty bittersweet for me. I'm really happy that, you know, Pam gets to be out there with a beautiful smile, and she's, you know, eating her steak and having a good time with her grandkids. But, you know, we don't get to see her as much, so, you know, we'll miss seeing her face around the office.